Welcome back to Today with Dr. Kaye. I'm Dr. Kaye Whitehead. I'm joined now by Dr. Letitia Dzirasa, Baltimore City's Health Commissioner. She joined in March 2019, and she's led the effort for Baltimore City's fight against COVID-19. Dr. Dzirasa, thank you for coming back to the show.
Dr. Kaye, thank you so much for having me, and it's good to see you in person.
Yes, it is. I want to congratulate you for being named as one of the Baltimore Sun's top 25 women to watch. You are really doing it, and we just appreciate you.
No, thank you.
So I wanted to talk with you very specifically today about the impact of COVID-19 on Baltimore's Black community. We're hearing all these stories about how it's disproportionately impacting the Black community as a whole. So if you can speak first and tell us how the Black community in Baltimore City has been impacted by COVID-19.
Sure. Well, again, Dr. Kaye, thanks so much for having me on the show and talking about such an important topic. We know that there have always been, from the beginning of when race and ethnicity data started to be reported, significant disparities in African Americans. When we think about a city like Baltimore City, about 63% of our population is African American. And when you look at the case breakdown in cases where we know race data, about 63% of cases are African American as well. What we see, though, is that African Americans account for 72% of deaths. So although we're relatively proportionate to our percentage in the population in terms of numbers, when we look at deaths, we do have a higher mortality rate, which is concerning.
So now, can you talk about the comorbidities? And I know we're all learning all this new terminology and we're talking about it, but what exactly does that mean?
Yeah, so I mean, again, the comorbidities, there are certain underlying health conditions that put you at greater risk for poorer health outcomes as a result of COVID-19. We know that being over the age of 65 increases your risk. We know that having some type of breathing condition, whether it be asthma or COPD, increases your risk. Having an underlying heart disease, having an underlying immune deficiency or weakened immune system, all increase your risk for more severe illness from COVID-19.
And we understand that these are illnesses that are present in our community based upon, a history of systemic racism. So how do we defeat COVID-19 without also solving these other problems around, our economically impoverished communities, around the state of our schools and what our children have to sit through? Like, how do we do that?
So I think you hit the nail on the head, right? We have to address those larger systemic issues and things that have led to us having more comorbidities, other things that have led to what we call the social determinants of health, right? So we know that the environment in which we live, work, grow, where we're born, where we worship, all impact our health outcomes. And that is certainly the case with African Americans. And so we have to take a much more comprehensive approach to addressing those things if we want to address the disparity seen in COVID and many other diseases that are out there.
Now, we know that based upon a long history of incidences that have negatively impacted our community, where our bodies have been used in inhumane ways, our community has a deep distrust of the medical community. I mean, people, when you start talking about it, everybody mentions Tuskegee, everybody mentions Henrietta Lacks. So how do we overcome this distrust, which is based in reality, to get Black people to trust science and scientists and take a vaccine?
Dr. Kaye, I think you raise an extremely important point, right? We first have to acknowledge that this medical mistrust exists and that it's grounded in events that happened, right? And so we can't ignore it. We can't say these things didn't happen. We don't understand why people believe this. They were very real and have had a significant and lasting impact, I think, on how African Americans approach the healthcare system. Much of what I've seen done is I've seen a lot of my fellow physicians who are Black really take the reins with providing accurate and up-to-date information. I think that we have to find those trusted voices in the community that can share accurate and up-to-date information on the vaccine and on what we know about the disease, right? Like, I think that's going to be such a big part as we continue to move through the pandemic.
How about with our children? So we're looking at the trial studies. I spoke to Dr. Freeman Rabowski from UMBC. He has signed up, his wife has signed up. But here in Baltimore City, when I think about our under 18 population, when will it be safe to actually vaccinate our children, our most precious jewel at this point?
Yeah. And I think what's challenging is that though obviously we're seeing some early indications that the vaccine is very effective, it may still be months while we're continuing to learn what the implications and side effects might be of the vaccine. And that's the reality of it, right? Like this is still a new virus, a novel virus, and it's a new vaccine. And so it's hard to say. I think again, I would look at the reports. I would go to trusted messengers in your community, trusted doctors at your federally qualified health centers to get the most accurate and up-to-date information. Speaking of the virus a little bit, we do know that Pfizer has released some data around minority participation in their clinical trials. And so I know that's a question as well. And their preliminary data shows that there isn't a difference in efficacy among ethnic groups. But certainly I get the real concern. I get the fear that exists.
Will this be like a flu shot, right? So every year we're told to go and take the flu shot. You may feel a little bad because even you were telling us this year you got to take the flu shot.
Yeah.
Do you think the vaccine is going to be like that? Take it every year.
I think we'll have to see. I mean, the thing about the flu is if the flu typically does change every year because, again, this is a novel virus. It's new. There's still a lot that we're learning about it. So I don't know that we can say yet at this point.
What was the moment for you, Dr. Dziraza, when COVID-19 was first introduced that you said this is going to be a hard one for our community? Like, it's just like, what was that moment that woke you up at night and said, okay, we got to do something quick?
I mean, I think certainly as it relates to our community and the city as a whole, I think once it was really declared that public health emergency, we working in public health know that disparities have existed, long before COVID around many other disease states. And I think we knew that COVID wasn't going to be any different. And so, unfortunately, I think from the very beginning, there was a sense that we would see these disparities.
In Maryland, our positivity rate is over 7%. Now, we were always told, now we are not scientists, we were just told that over 5% was too much. What is the positivity rate for Baltimore?
Right now, actually, our daily positivity, I think we're around 5.5%, but it's fluctuated over this past week. And we did see a dip in testing during that holiday break. And so I anticipate that we're going to see that positivity go up as people are getting tested post Thanksgiving and possibly post traveling.
Do you find that the Baltimore City Black community is actually doing a better job with implementing some of the concerns? I saw research that said that Black people in America were quicker to wear the mask, to get the hand, to be afraid that this was really going to devastate our community.
Yeah, I mean, I think anecdotally, it's been variable, right? I mean, I think certainly the probably the large group, and it's less maybe along racial or ethnic lines, and more when we think about kind of age groups that have been impacted with this kind of second wave. We're certainly seeing increase among younger people. So I probably worry a lot about just young people in general not being as mindful of the precautions because we were seeing such a high spike in that age group. I think another group that obviously has been challenged is our Latinx community. And we've seen certainly a very high positivity in our Latinx community as well.
When you talk about age groups, are you talking about the under 30 population?
I'm talking about probably 20 to 39, so kind of right in the middle there.
How about holistic treatments? People, I mean, we know we're taking our vitamin C, we're taking our airborne. I mean, I think I've been taking so much zinc now, I'm getting, but people are thinking maybe if I build up my immune system, then I can still kind of have somewhat of a normal life here. Do those two things work together?
I think that unfortunately that there's a new normal, and I don't know that we'll get back to the normal life and for a little while, right? And so I think that it's certainly fine to do all of the holistic measures, and I myself am a fan of elderberry, and so certainly great to do those things, but we also have to continue the other personal protective measures that we're putting in place, and acknowledge that anytime you leave your house, there's a risk, right? Like there is a risk of potentially coming in contact with someone who has COVID-19 because there is widespread community transmission. So you should always have your mask on over your nose and your mouth. You should carry your hand sanitizer, be washing your hands frequently. If you're not feeling well, or if you know someone else isn't feeling well, you should avoid contact with that person. Certainly, if you're not feeling well, you should also stay home and not be going into work, which I know can be challenging depending on the line of work that you do. So even with doing all the holistic measures, all of the other advice we've given hasn't changed.
Let me ask you, why is it that a family can be impacted by COVID-19, but it will affect every single family member differently? One person ends up, I know a family where one person ended up on a ventilator, one was asymptomatic, one had back pain, all in the same household.
Yeah, again, this is a novel virus. So similar to flu, where some people with flu, they get the vomiting and the diarrhea, and they don't necessarily get some of the other symptoms, where other people, it's mostly, respiratory dominant. It just like any other virus, behaves differently in different people.
So let me ask you, in my last two questions here. So I know you have a young child. I know you have a partner. So will you and your family get in line and take the vaccine?
We will. We will. So my son is in daycare, and so again, recognizing that even as much as we try to be insulated, and he still goes out. He still goes out. He's still among other children, and so I would want him to be protected. I would want the other children that he's with to be protected as well.
Mixed messages about what is happening with COVID-19. We had a chance to speak to Dr. Fauci. He said go to the CDC and get your information from there. But the internet is spreading so much information. What would you really recommend to people? There's a lot of fear, there's a lot of concern, there's a lot of misinformation. You don't know who to trust. The CDC, the guidelines keep changing. It was 14 days quarantine. Now it's 7 to 10 days. It was no mask. Now wear a mask. Like it was 2 feet. Now it's 6 feet. Like it's overwhelming.
Yeah.
So
And I definitely get that, right? I think the thing that I will harp on, and I'll echo Dr. Fauci in that the CDC is going to be your best resource, is that this is a novel virus, the novel coronavirus, meaning it's new. We've known about this virus now for less than a year. And so we are still learning many things about how this virus behaves. Much of the information that was released early on was based on what we knew about other viruses in the same family as this virus. We continue to learn more. The CDC puts out these reports regularly. They do studies regularly. And that's how they guide their decisioning around quarantine periods, around mask versus no mask. And so I would anticipate that other things may change in the future. And I think it's always good to be mindful of that. We are still very much learning. And at the same time, I know it's tricky because we're also treating and we're trying to survive a pandemic. But the CDC is going to be your best resource. And again, I would anticipate that data will continue to change as we learn more.
So Dr. Dziraza, to recap, you're going to take the vaccine. You would suggest that we take it. You're going to continue to social distance, wear your mask, wash your hands, continue to follow all the guidelines.
Everything.
Because the normal that we're in
Right.
may continue. Like I'm concerned that we're going to be wearing masks forever at this point.
We'll be wearing them for a while. And again, I will say, as much as things change, some of the things that we know are not going to change are that washing your hands is good hygiene and practice. Staying home if you're sick is good hygiene and practice. In this case, we know that wearing the mask now is good hygiene and practice. I think, again, some of the concerns early on was not having enough for our healthcare workers. And now recognizing that, the layperson can wear the mask. So I think some of those standard things, those things I think we've been saying since the beginning, the importance of hand washing and distancing and those types of things, that I don't anticipate changing.
Dr. Dziraza, Baltimore City's Health Commissioner, we thank you so much for your time today.
Thank you.
Bye. And folks, stay with us. When we return, we're going to have more on talking about the impact of COVID-19 on the Black community. Stay with us.